Kourzeq 0.1% dental paste steroids is a medication used to temporarily relieve symptoms from mouth sores due to injury. It comes in a dental paste form, which allows it to stick to the inside of the mouth, cheeks, and gums. The medication works by reducing the swelling, itching, and pain that can occur with mouth sores. It is classified as a medium-strength corticosteroid. The recommended dosage and timing for using this medication should be determined by your healthcare provider. Avoid applying this medication to the eyes or skin, as it is meant for use only inside the mouth. To apply the paste, dab or press a small amount onto the affected area until a smooth, slippery film develops. Do not attempt to spread or rub the paste in, as this can cause it to become crumbly, grainy, or gritty. You can use a cotton swab to apply the paste. Follow your doctor or dentist's directions and usually apply the paste 2 to 3 times daily after meals or at bedtime. Do not cover the treated area unless directed to do so by your doctor or dentist. If you notice that your mouth infections are getting worse while using this medication, be sure to inform your doctor or dentist. Let them know if your condition lasts or worsens after 7 to 14 days of treatment. If you experience burning, itching, irritation, dryness, or redness in the treated area, it's important to notify your doctor, dentist, or pharmacist. It's important to remember that this medication has been prescribed to you because the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it's important to tell your doctor if you experience blistering or peeling. In rare cases, this medication can be absorbed into the bloodstream, especially in children or with long-term use, which can lead to side effects of too much corticosteroid. If you experience unusual tiredness, weight loss, headache, swelling ankles or feet, increased thirst and urination, or vision problems, it's important to inform your doctor. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, contact your doctor or pharmacist for advice. Before using Kourzeq 0.1% dental paste steroids, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to inform your doctor, dentist, or pharmacist about your medical history, especially if you have a herpes-type infection or other infections/sores in the mouth or throat. Long-term use of corticosteroid medications like Kourzeq 0.1% dental paste steroids may make it harder for your body to respond to physical stress. Before undergoing surgery, emergency treatment, or if you experience a serious illness or injury, be sure to inform your doctor or dentist that you are using this medication or have used it within the past few months. There is a possibility that this medication may temporarily slow down a child's growth if used for an extended period of time. It's important to have your child's height checked regularly by a doctor. If you are pregnant, Kourzeq 0.1% dental paste steroids should only be used if clearly needed. It's important to discuss the risks and benefits with your doctor. It is also unknown if this form of triamcinolone passes into breast milk, so it's best to consult your doctor before breastfeeding. As for the details of using this medication, the daily dosage and optimal timing should be determined by your doctor or pharmacist. Be sure to follow their instructions carefully. It's important to be aware that Kourzeq 0.1% dental paste steroids mouth may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This is to ensure the safe and effective use of Kourzeq 0.1% dental paste steroids mouth. If you or someone else has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. However, it's unlikely for an overdose to occur even if the medication is swallowed. Do not share this medication with others. This medication has been prescribed for your current condition only. Do not use it later for another occurrence. A different medication may be necessary in those cases. If you are directed to use this medication for a long time, lab and/or medical tests may be done while you are using this medication. Keep all medical and lab appointments. Consult your doctor for more details. If you forget to take a dose of Kourzeq 0.1% dental paste, use it as soon as you remember. If it's almost time for your next dose, just skip the missed one and use the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember to always follow your doctor's instructions for the best results. Remember to store Kourzeq 0.1% dental paste steroids at room temperature and keep it out of reach of children and pets. It's important not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When it's expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.